I'll notify you when I leave.
Sure, ma'am, sure. And it's so nice to see you back. Hearty welcome to the program once again.
Thank you. Thank you.
Okay, Harshita, have you joined?
She's here, but she's at some.
Hello, ma'am.
Good evening. Yeah, hi,
sir.
Harshita.
Good evening, ma'am.
Yeah, hi,
I'm
Harshita.
doing patient.
Or I just need 5 minutes from you before you go to the patient. Can you please just give a call to our faculty?
Sure, ma'am. I'm calling them.
Yeah, just please give a call.
Sure, ma'am. Sure, ma'am.
Shalini ma'am, Preeti ma'am, and Anuradha ma'am have joined. Sonal ma'am has joined. So just give a call, short call to others quickly.
The other thing, Shruti, I can do is I can have our nodal officer who's looking at tobacco control studies join you. Dr. Prashant, is that will that be okay?
Yeah, that would be also great. Yeah, that would be also great, ma'am. Yeah,
so
yeah,
let me check. Let me check with him because this thing just came up suddenly. Let me check and let you get back to you.
Sure, ma'am. That would be really nice.
All
Thank
right.
you.
Yeah.
Hello. Hello, everyone.
Hello, Preeti ma'am.
Hello. Good evening.
Good evening, Garima ji. Good evening.
Hello, Shruti ji. कैसे हो आप?
Rekha ma'am. Good evening. आप कैसे हैं? I'm all good.
Good evening.
Good evening, ma'am.
Hello,
good evening.
Hello, नीरू कैसे हैं?
हाँ बढ़िया एकदम सब बढ़िया हाँ जी आदेश जी आप कैसी हैं
आज तो नीरू जी की एनिवर्सरी है जी
हाँ नीरू जी many congratulations
थैंक यू
हाँ चलिए पब्लिक हो गई
रेखा जी नीरू जी
हाँ जी हाँ
I am giving you some responsibility to call the presidents of the club.
हाँ जी
Tell them to join them.
Already done, ma'am. Already done. Since morning, I am doing this duty.
हाँ संगीता जी बोलो फटाफट हेलो
Please take responsibility of your zone.
Okay, ma'am.
All the
Okay.
presidents.
Okay, ma'am.
Sonal ma'am and sir, can we start the program? I think in the meantime, our special guest will join because it's already 3:05. We have a long program to be for today. Can I start the program with your permission?
Just give me a minute. Let few dignitaries also join. Just
Yeah, Dr. Swasticharan and Dr. Biswajit Saha have not joined yet.
Hello everyone.
Hello. Hello, everyone.
Hello ma'am.
Hello. Hello. कैसे हो?
Hello, Sonal ma'am. Hello, everyone.
Hello, everyone.
Hello, ma'am.
Hello, everyone. Hello.
Hello,
Chavi.
hello.
How are you? Hello.
Hello, ma'am.
हेलो संगीता जी मीटिंग ज्वाइन करिए
Hello, everyone. Hello to everyone. Good afternoon. Inner Wheel Club Dist to all of you. Hello.
Hello, hello.
Hello.
Good afternoon.
क्या काउंटर हो गई हैं ये क्यों बोल रहे हो
Hello.
मैम ड्रिप चल रही है हमारे पेशेंट की ड्रिप चल रही है
Good evening,
मीटिंग
Sonal.
ज्वाइन कर रहे हैं डॉक्टर पवन देखिए हमारे पेशेंट की ड्रिप चल रही है और हमारा क्लब मेंबर ही है ये सीवियर वॉमिटिंग हो रही है तो हमने मीटिंग ज्वाइन करा लिया वॉइस नहीं आ रही
Well, like a patient and a doctor both are there in the same place.
हेलो सर
everyone. Hello, सबको.
हेलो मैम
Hello.
हेलो मैम
नमस्कार मैम.
Hello, everyone.
Hello, good afternoon, everybody. Good afternoon. Good afternoon.
Hello. Hello. Hello, Saroj ji.
हेलो रेखा जी
Hello. Hello, Suna ji.
Hello, Rekha ji.
Hello, Anji. Hello. हेलो दीदी हाँ अब आवाज आ रही है हेलो
इसको ये भर कर अरे ऐसे करके आ जाता है
Pawan sir, Swasti sir and Biswajit sir have not joined yet.
I just called them. They're already they're just joining in 2 minutes.
नमस्कार मैम
So should we start in the meantime or should we still wait for them?
Just joining in 2 minutes.
Okay.
नहीं वो जी सही हो गया
In the meantime, I'll request if everyone can please put yourself on mute. Please use the chat box communication. Otherwise, there's a lot of disturbance. I'll please request if all of you can put yourself on mute.
Preeti ma'am join कीजिए.
Preeti Sudan ma'am has joined. Preeti Gungrani ma'am has not joined.
Sonal ma'am, Preeti ma'am join कर रहे हैं.
I'm just ringing.
Just to convey to our chief guest, Preeti Sudan ma'am. Ma'am, okay. All of these are our tobacco marshals and they have been trained and they are really working hard in the society to control or to tame the slave, tame the biggest asur, that is the tobacco asur, right? So that is what we are doing, and you can see the enthusiasm and the the way every one of them are working. This is what we will actually showcase. So it is really a pleasure to have so many tobacco marshals together and working in the society to bring the end to the tobacco epidemic. I think we will.
हेलो कुमकुम जी
I really really obliged, ma'am, Preeti ma'am, that Preeti Sudan ma'am, that so there are actually a lot of Preetis today, and lot Dr. Preeti Gubnani, Preeti Sudan, Preeti Vishnoi, right? So
नाम एक ही है.
Wherever I have worked, I always had at least 3 Preetis working with me. So it's nice to be with Preetis again.
so thank you so much, ma'am. By the way, ma'am, Sonal Bhatia, she is the DC district chairman of Inner Wheel Club 310, and she has been actively taking this campaign of tobacco marshal amongst the entire district. And her term is coming to an end on June 30th, and she has extensively she has covered almost 1,000 tobacco marshals. She has 250 approx from her club, and then she has trained 550 plus 650 almost tobacco marshals out of the club. And she has extensively worked for this creating tobacco marshals in the society.
So congratulations to her and to everyone who's present. I'm really sort of it's very heartening to see so much of enthusiasm for such a noble cause. God bless you all.
And the thing that you started during your term as a secretary to control this big menace. So this is being taken forward by a lot of people. And I think the guidance that you will give today, maybe that will go a long way to motivate more and more people to join into this campaign.
Sure. Thank you. Thank you for having me here. Thank you.
Okay. पहले क्वेश्चन हाँ, हम लोग वेट कर रहे थे ना सबके ज्वाइन करने के लिए, तो लेट कर दिया, नहीं तो हम लोग पहले ही स्टार्ट कर देते। ठीक है, स्टार्ट कर देते। तो मेरा सभी से रिक्वेस्ट रहेगा कि प्लीज कीप योरसेल्फ ऑन म्यूट and we will just start. Shruti, can we start, please?
Absolutely, sir. I've been waiting for permission to start right away.
We are already 40 minutes late. Please go.
Yes. So, if you can please drop a reminder to our special guests again, Dr. Swasticharan and Dr. Biswajit.
Yeah, he's just joining. He has a meeting again, so he is just joining. So please start so that we can.
So warm good evening, everyone. Thank you for joining on this beautiful weekday, I must say, because normally our programs are always on Sundays, but this is a weekday and everyone has taken time to join on this wonderful discussion once again, which is organized by Inner Wheel Club District 310 and ICanCaRe on discussing about women as the new power center for tobacco control. This evening, we have with us elite guests and extraordinary individuals from across different fields, from across different industries who have had their contributions and have made excellent contribution in terms of tobacco control and have proved their mettle as to how wonderfully women, when empowered, can bring in numerous changes, a lot of changes to create impact for secession as well as sustainable enforcement. Before I begin the session formally, I'll request everyone, please put yourself on mute. All the speakers have been given the co-host rights. Use the chat box extensively. If you need to talk, you can raise hand and our moderators will get in touch with you for concerns. Ensure that the video is on in the proper mode. This is being telecasted across multiple social media platforms, and any breach can lead to actions as per the IT laws of the country. So please just ensure that you are enjoying the program. Use the chat box extensively for any sort of communication. And now I invite our dearest district chairperson, Mrs. Sonal Bhatia ma'am, to please call the meeting to order. Sonal ma'am, over to you.
Okay, meeting is called to order.
Thank you so much, ma'am. And now we move towards digital lamp lighting. The pictures will
ceremony.
Thank you, ma'am. So the pictures will automatically light as the lamps light.
On behalf of my district secretary, Anita Singh ji, I am wearing this collar.
Kurutvam kalyanam सम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
I think it's displaying again. I'm so sorry. Let's move ahead with the inner wheel prayer.
Inner wheel अभिवादन. Inner wheel prayer. मित्र भाव के सत्य अर्थ को हम सब में हे ईश्वर भर दो, हम सब ही हैं तेरे बालक, भूले ना यह इतना कर दो। धर्म और संस्कृति भेदों का मन में नहीं स्थान रहे, सभी मानवों की सेवा का हमें सदा ही ध्यान रहे। आवश्यकता हमें मदद की हो सकती यह याद रहे, सेवा करने की जरूरतें जहां कहीं भी आन पड़े, सेवा करने को सब जन की तत्पर हम सब डटे रहें। इनर व्हील की शान बढ़ाएं, यह वर हमें प्रदान करो, मानव जीवन व्यर्थ न जाए, प्रभु यह कृपा प्रदान करो।
That was the inner wheel prayer, and I take this privilege to introduce quickly a very short introduction to our special guest for the evening, Mrs. Preeti Sudan, IAS and ex-secretary for Ministry of Health and Family Welfare, Government of India. Dr. L. Swasticharan, Additional Deputy Director General, National Tobacco Control Program, again from Ministry of Health and Family Welfare, Government of India. Dr. Biswajit Saha, Director, Training and Skilled Education, CBSE under MHRD from Government of India. We have our representatives from Inner Wheel, Mrs. Preeti Gungrani, Inner Wheel Association Vice President and Deputy National Representative for the year 2022-23, Mrs. Anuradha Chandak, Honorary Association Secretary for the year 21-22, Association of Inner Wheel Clubs of India, and Mrs. Veena Swami, National Editor, 2021-22, Association of Inner Wheel Clubs of India. We have a faculty, our esteemed faculty for the evening. Dr. Smitha Deshpande is not available with us. Dr. Shalini Singh, Director, National Institute of Cancer Prevention and Research, Noida. Mrs. Dr. Sunila Garg, National President of OMAG, National President of IAPSM, immediate past and ex-head of CM, Sub-Dean, MAMC, and Head Community Medicine Advisory Committee of National Institute of Health and Family Welfare. Professor Dr. Parimita Sengupta, HOD from Community Medicine and Family Medicine Department from AIIMS, Kalyani. Mr. Praveen Sinha. Mr. Praveen Sinha, member from the WHO India for Tobacco Free Initiative. Mrs. Pravesh Singh, Professor from Department of Electronics and Communication, Chairperson of Ek Prayas from Kite Group of Institutions, Delhi NCR, Ghaziabad. Convener for the program, Dr. Pawan Gupta, founder of ICanCaRe, Director of Surgical Oncology at Max Hospital, Delhi NCR region, Mrs. Sonal Bhatia, District Chairman of Inner Wheel District 310, Dr. Reena Kumar, Academic Director from ICanCaRe. Our own team, myself, your host for the evening, Shri Agrawal, Chief Strategic Officer, Mr. Rishabh Agrawal, CEO and Director of ICanCaRe, Dr. Harshita Pandey, our session specialist and educational planner, Dr. Commander for Save the Youth campaign for the Delhi region. So here is in front of you a beautiful picture of a woman demonstrating how multitasking and how dynamic they have become over the years. Very, very vigilant, very, very keen and a perfectionist in managing both their home and profession. There has been a great transition in terms of how they're adapting to the changing lifestyles and all sorts of adaptation to the modern responsibilities in terms of both fulfilling as a mother, daughter, wife, and a professionalist in their work profession. However, the main concern for today's topic and the main highlight is that empowerment with right education can create ripples by women across different professions and across different intellects. And I'm very, very happy to share that one of the extraordinary women who has really proved this and has led the footsteps in a very a public-private setting of how this empowerment can be brought down and how this empowerment can lead to lead to taming one of the social evils of the country, that is tobacco, is what we are going to see today. So I'm going to invite Mrs. Sonal Bhatia again, District Chairperson. She has been a Diamond Secretary for her extraordinary contribution for welfare activities and projects had numerous awards, including the Platinum President Award and DC Appreciation Award, has been a formal zonal literacy club coordinator and district editor, and her hobbies include cooking, music, painting, traveling. Her mantra is life is to be positive. So I have this question for ma'am, that she started with this project, a target 1000, and she has been always saying that I'm a woman and I want my sisters, daughters to be free from the slavery of tobacco. We have to end the suffering. So what gave you this, what do I say, the encouragement, the motivation to take up this project? You had so many projects at hand while your tenure, but what made this project so special?
First of all, Inner Wheel Naman to all of you. I, Mrs. Sonal Bhatia, District Chairman of District 310, on behalf of entire team of District 310, warmly welcome you all. I welcome our special guest of today, Mrs. Preeti Sudan ji, Dr. L. Swasticharan, Dr. Biswajit Saha, our Association Vice President, Preeti Gugnani ji, Honorary Association Secretary, Anuradha Chandak ji, National Editor, Veena Swamiji, and all the Inner Wheel members and all doctors, ICanCaRe team, and everyone present over here. Inner Wheel Naman to all of you. One of the biggest curses from which nation is suffering is consumption of tobacco and its products in various forms. These days, its consumption has become quite popular among the youth and is being depicted as the symbol of fashion. Many youngsters are fascinated towards it. In order to save the youth of today, in order to save our children from this unnecessary evil, it is necessary to have proper scientific knowledge regarding it. We, the women of Inner Wheel District 310, decided to tackle this monster, which is a colossal crime against the society. As the problem is in society arises, it is the duty of every individual to ease the burden by helping to solve these problems. Too often, individuals pass off that responsibility with the hope that others will pick up the slack. The problem is that too many shrug their responsibility, leaving an insurmountable degree of perils. It is everyone's obligation to help solve the problems because everyone has a stake in society. Not enough people see the whole picture when it comes to the society. I will give back to the society that helped me reach this point. I want to make a difference, and I feel through Inner Wheel District 310, I can do it. By the grace of Almighty, I met ICanCaRe team of doctors, especially Dr. Pawan Gupta ji, who told me about empowering women against tobacco outrage. I was enthralled to hear this concept and wish to go the extra mile for this, with a single goal in my mind: helping people to quit tobacco and save our children from this monster. Inner Wheel District 310 joined hands with ICanCaRe in a campaign, Save the Youth campaign. An introductory meeting was kept with ICanCaRe team to give us insight of this problem and ways to confront it, was attended by various presidents of my district. In this meeting, we were given vision to the duties of tobacco marshals. A decision by all the 80 presidents of my Inner Wheel District 310 to enthusiastically be a part of this program and become a tobacco marshal themselves was the need of the hour, which motivated me to proceed further with this project. Thus, we all began with this tobacco marshal journey. My all Shiros, my all pink stars were there with me in this campaign, and we all pledged to beat tobacco. They were leaders of change. Inner Wheel District 310 is taking all the steps to make tobacco use an outrage rather than an acceptable norm. New era has begun, and it is the era of tobacco marshals. I tried my best in changing my Shiros as Inner Wheel tobacco marshals to take Tambaku Asur head on, because they are real heroes in the society, those who can fight against this tobacco. This is my wish, and I want each and every Inner Wheel member of District 310, not only District 310, I want each and every member of Inner Wheel to be a marshal to fight against this social evil. Thank you so much, Shruti.
Thank you so much, ma'am. And I'm totally honored to listen to your kind words and to witness, and I'm sure all our audience are completely enthralled to witness this passion and this energy which has come from Inner Wheel. Here's a short glimpse of how the tobacco marshals in the short span of just 1.5 months have created ripples in combating this crime in the given districts. Some of the examples of the community program, and there's a short video which I'm going to play it quickly. This is in the corporate setup, in the school setup, in the social club level, at the school and the college level, with girls, with boys, poster making competitions. This is one of the signature projects which was taken up for NCC Girls Cadet and widely published in the media, where these girls were trained as little marshals and were empowered to take tobacco control ahead in the society. Widely featured in the newspapers. So I'll quickly share the video of the activities.
It's a bond that lets us be one. The strength to make us grow and have trust in each other. We're strong women with heart and soul. All around the world, we're having faith in one another. Joy of mutuality makes us a strong community. We're the axle making the world go round. In our wheel means joining together. In our wheel means friendship forever. In our wheel it's harmony we feel. Standing together in our wheel.
So this is a short glimpse of what has been done at all the community levels. So who exactly are these marshals? A person who starts the entire day by motivating individuals to stay a healthy life, goes on to create awareness, recognizes the people in time, sensitizes and creates surveillance, helps tobacco addicts cook with the habit very successfully, assists in establishing tobacco-free institutes, and ultimately leads for tobacco control in the society. The main influencers who are here to save the youth from initiation, encourage tobacco cessation, propagate negative attitudes toward tobacco use, induct more and more people so that the network strengthens for creating tobacco enforcement, control, and cessation into place, and increase support for policy change so that we have more tobacco-free zones and healthy workplaces. These are the tobacco marshals, and I would now take this privilege to invite Neeru Gupta, ma'am, president of IWC of Chandapur Arohi Club, to quickly speak in a few words about her experience as a marshal and how she has created this impact in the public-private setting.
Hello everyone. यहाँ उपस्थित respected association district executives and Dr. पवन गुप्ता जी and सोनल मैम और मेरी सभी प्यारे इनर व्हील फ्रेंड्स। मैम जैसे ये था कि आज हम लोगों की मीटिंग है और हम लोग टोबैको मार्शल्स
नहीं आ रही है।
मैम एक बार प्लीज ऑडियो चेक करें, वी कैन हियर नीरू मैम क्लियरली। मैम प्लीज गो अहेड। जी जी मैम प्लीज गो अहेड।
आप सभी का मैं हार्दिक अभिनंदन करती हूँ और सबको मेरा नमस्कार।
नीरू जी आवाज नहीं आ रही।
But we can hear.
जैसे कि
हमें आ रही है,
आवाज
साफ
आ रही
आवाज
है।
आ रही है, बिल्कुल साफ आ रही है।
जैसे कि
आवाज साफ आ रही है।
हमारी 310
Niru ji, keep speaking. We are hearing you. बोलिए।
डिस्ट्रिक्ट 310 से हमारी डिस्ट्रिक्ट चेयरमैन सोनल भाटिया जी के एफर्ट्स के कारण हम लोग यहाँ टोबैको मार्शल के रूप में आप सबके सामने हैं। और हमारी डिस्ट्रिक्ट चेयरमैन का एक ड्रीम था कि जो सोसाइटी में यूथ इस समय बहुत ज्यादा टोबैको की तरफ जा रहा है, उसको हम कैसे बचाएं। बेटा उसको हम कैसे बचाएं, तो उसी को लेकर के उन्होंने एक ये मुहिम छेड़ी और ICanCaRe जो कि डॉक्टर पवन गुप्ता जी की टीम के द्वारा चल रहा है, उससे एक सेटल किया उन्होंने एक प्रोग्राम और हम सबको उन्होंने बहुत एनकरेज किया, ट्रेनिंग दी और उसके फलस्वरूप आज हम आप लोगों के सामने टोबैको मार्शल के रूप में हैं। शुरू में हमें भी लग रहा था कि जब मैम ने बोला कि भाई आप लोग इसकी ट्रेनिंग लीजिए, टोबैको मार्शल के लिए आइए, आगे बढ़िए, तो मैंने भी अपने क्लब में जब भी बात की तो सबको लगता था कि अरे किसी पे कोई असर नहीं होता है, सब जो लोग शुरू कर देते हैं कोई नहीं सुनते, कोई नहीं मानते। लेकिन तब भी मैम के बराबर मैम एफर्ट करती रही, फिर इधर मैं अपने क्लब में कहती रही, तो कुछ लोग जो धीरे धीरे आगे आए। फिर जब मैंने ज्वाइन की तो रियली मुझे खुद लगा कि हाँ वाकई मतलब जो चीजें हमें पता ही नहीं थी कि हम कैसे समझाएं लोगों को, तो वो सब चीजें हमें नॉलेज मिली हमें। और उस नॉलेज के साथ जब हम आगे बढ़े और मैंने खुद लोगों से मिलके लोगों को समझाया तो लगा कि हाँ एक ठीक तरीके से अब हम उन्हें समझा पा रहे हैं। नो टोबैको डे पर भी हम लोगों ने एक प्रोजेक्ट किया, स्कूल में किया हमने। 4th क्लास स्टाफ जितना भी था, सभी ड्राइवर्स, कंडक्टर्स, स्वीपर्स, मेड्स जितनी भी थी, उन सभी के लिए हम लोगों ने स्मार्ट बोर्ड पर प्रोजेक्टर के थ्रू स्लाइड दिखाई जो मैम ने हमें शुरू में दी थी। और सच में मतलब फील हुआ। फिर बाद में जब उन लोगों से मैंने बात भी की तो उन्हें भी लगा कि हाँ भाई तंबाकू से हमें मतलब दूर रहना चाहिए। तो ये सब चीजें काफी इफेक्टिव हो रही हैं इस ट्रेनिंग के बाद, जो हमें शुरू में नहीं महसूस हो रही थी, लेकिन ट्रेनिंग लेने के बाद लगा कि फिर डॉक्टर पवन गुप्ता और रीना जी के लिए हम लोग बहुत थैंकफुल हैं, सोनल जी के लिए बहुत थैंकफुल हैं कि उन्होंने हमें इस चीज से जोड़ा और सोसाइटी के लिए हम लोग कुछ कर पाएंगे, स्पेशली यूथ के लिए। ये लगा कि जो लोग ले रहे हैं उन्हें हम कितना रोक पाते हैं अभी नहीं मुझे आइडिया हो रहा है, लेकिन जो कमिंग जनरेशन है, नेक्स्ट जनरेशन है जो इस तरफ बढ़ने की तैयारी में है टोबैको की तरफ, तो उसे तो हम मतलब काफी रोक सकते हैं। मैं अपने क्लब में भी कह रही हूँ कि अगर हम एक जना 5 या 10 लोगों को भी अगर रोक पाया तो शायद सोसाइटी में एक अच्छा चेंज आएगा, क्योंकि जो आज की युवा पीढ़ी है वही आगे की हमारी पूरा राष्ट्र के लिए की धरोहर है वो, तो उन्हें बचाना एक बहुत जरूरी काम है। और ये सोनल मैम के कारण हम लोग कर पाएंगे, कर रहे हैं, और उनको बहुत बहुत थैंक्स कि उन्होंने हमें इससे जोड़ा। थैंक यू।
थैंक यू सो मच नीरू मैम, आई मस्ट अप्रिशिएट। और आपने एक बहुत सटीक बात कही कि एक जब चेन क्रिएट होता है, जब एक व्यक्ति 5 लोगों तक पहुंचेगा और वो चेन बढ़ता जाए तो हम बहुत लोगों तक मास में पहुंच सकते हैं। और यही मुख्य कारण है कि इस मुहिम को चालू किया गया है और सेव द यूथ कैंपेन के तहत टोबैको कंट्रोल एक्टिविटीज करे जा रहे हैं। नाउ लेडीज एंड जेंटलमैन, We move towards the scientific panel discussion of our evening, the main topic of discussion. So I would like to introduce all our guests very formally. We have with us Mrs. Preeti Sudan, former Secretary of Health and IS officer of the 1983 batch, served as a Secretary of Health from October 2017 to 2020. She's also a WHO appointed member of the Independent Panel for Pandemic Preparedness and Response, has a doctorate degree in Economics and Social Policy and Planning from London School of Economics, has been trained in Public Finance Management, is a public committee health expert, and is known for some of the remarkable decisions, especially for managing the entities. He has been a key strategist during the COVID pandemic and has served as the Secretary, Department of Food and Public Distribution, Ministry of Consumer Affairs and Public Distribution. We also have with us Dr. S. Swasticharan, Additional Deputy Director General of Health Services and Director of Emergency Medical Relief at Directorate General of Health Services, Ministry of Health and Family Welfare, Government of India. So it is currently in charge of the National Tobacco Control Program. He has a MD degree in Community Health Administration from Delhi University. Was also trained in leadership program in global tobacco control in John Hopkins School, and his area of work inter alia many public health issues is integration of health programs for synergistic and better implementation of programs and scientific evidence, policy and implementation. We have with us Dr. Biswajit Saha, Director of CBSE under Ministry of Education, Government of India. So, is a Director of Training and Skills Education and is involved with the design of curriculum development of student books and training manuals. Monitors the execution of various teachers training program by 16 CBSE Centers of Excellences. Prior to joining CBSE, he was faculty member of Government Engineering College and served as the OSD for Technical Education under the Government of Tripura. Sir has handled various execution development projects of the World Bank, Ministry of Information Technology as a research project of AICTE and UCG, and has actively participated in drafting of NVEQF, Christian as National Skill Qualification Framework notified by Government of India in 2012 and 13 respectively. We have with us Mrs. Preeti Sudan. She is an educationist, an entrepreneur, a social service worker, and an iron lady, as I must say. She started schools in the name of Scholars Rosary Group of Schools in Rohtak, Haryana. Today, she has more than 5,000 children and more than 200 teachers running under this school successfully, with more than 4 branches across the country. Awarded with numerous awards, mostly the Best Women Entrepreneur by Kalpataru Women's Organization, Renowned Educationist Award by Dainik Bhaskar consecutively for 3 years, Rotary Service Award for Exemplary Community Service in 2017, and much more. He conceptualized and built a multimedia center, Chirag, for blind children at the National Association for Blind, with special computers and equipment to ease the learning process and widen their access to multimedia resources, and continues to working undeterred and tirelessly on women empowerment, child and adult education, sanitation, blood donation camps, so on and so forth. We welcome Dr. Shalini Singh, Director of the NICPR. Madam is the Director of the National Tobacco Testing Laboratory, High Throughput Viral Diagnostic Facility for COVID-19 testing. The clinician for more than 3 decades of work experience, has worked in various settings, including medical college, undergraduate and postgraduate teaching, research administrator at the ICMR. Current areas of work include capacity building of different cadres of healthcare providers for screening and early management of oral, breast and cervical cancer. We welcome Professor Dr. Paramita Sengupta, HOD from Department of Community Medicine and Family Medicine, AIIMS Kalyani. Ma'am has demonstrated history of working in multiple community-based ICMR research project as principal investigator. Recently started immunization clinic and COVID vaccination clinic at AIIMS Kalyani, has 54 publications to her name, is a strong educational professor, a professional having MD degree in community medicine and a master's degree from the Manchester Metropolitan University. We welcome Professor Sunila Garg. Can I request others to please put themselves on mute so that it becomes easy for others? We welcome Professor Sunila Garg, Director of the Community Medicine, Maulana Azad Medical College. Ma'am has been a National President of the IAPSM, National President of OMAG, Professor of Excellence, Director, Professor at HAG, Fellow of the HIV Medicine, Fellow of WHO and DFID, Advisor of the ICMR Member Task Force, and Advisor of the CBM. We welcome Mrs. Saroj, Professor and teacher from the Departments of Electronics and Engineering from Kite Group of Institutions, BTech and a MTech and a PhD holder in the Electronics and Communication Engineering with more than 17 years of experience, India's first tobacco marshal, and also the President of 8 Prayas at Kite Group of Institutions. We welcome Mr. Praveen Sinha, National Professional Officer from WHO India, Mrs. Anuradha Chandak, Honorary Association Secretary, Association of Inner Wheel Clubs of India for the year 2021-22. She's the winner of the state level writing award, invited as judge and chief guest in more than 200 events. In the first year of her service as the president, she bagged the Best President, Best Club award with more than 14 awards to her name, encouraged 52 women to join the members, handled the governor's post in 2020. In the year of service, she established 12 new clubs and invited 500 new members to join the club. Has delivered community welfare projects worth 5 crore in the previous 2 years. Loves to write and compose poems as well. We welcome Mrs. Veena Swami, National Editor for the Inner Wheel Associations Club of India for 2021-22. Madam also has 25 years of service experience and has bagged Best Secretary, Best Outstanding President, Best All-Round Club, and many more 18 such awards. As the district chairperson, she created history by creating 7 new clubs in the district of 316, where the international president visited themselves during that year. During the Teach project, she inaugurated 85 happy schools, received the Best Chairman Award from Rotary International, has successfully highlighted 1,200 projects, 400 of which were featured in the International Journal and also on the website. 35 projects were posted on the association page within the given tenure. Recently, the account has been upgraded with Twitter social media account. Editor's e-handbook has been introduced, and her book, Array of Inner Wheel with Pink Stars, has been released, which has received a lot of accolades and appreciation from the society. I now invite Dr. Pawan Gupta, the moderator for the evening. We know him very well. He's the head and neck oncosurgeon, director at the Max Super Specialty Hospital, more than 11,000 cancer successful surgeries to his name, author of various books, recipient of multiple awards, and founder of Innovative Cancer Care. So I invite sir to please take this panel discussion ahead.
Thank you, Shruti. And I think we will quickly go to the panel discussion, and we have such luminaries here. And if I can see, means all the great dignitaries who have been working extensively in tobacco across. So I would request, since Dr. Swasticharan indicated that he has to attend another meeting, sir, if you are there, can we go ahead with a special, with your remarks, sir, first? Dr.
Yes, Pawan, I'm here. Thank you.
Thank you so much, sir. So we just saw how these tobacco marshals have been working, and how this means we are also aware that the government of India is working extensively for tobacco control. This we have been doing a lot of intermittent activities, like going to the schools, doing some activities, and then stopping, then going to another school. The tobacco marshal actually envisages that we have persistent tobacco marshals in the school, in the colleges, or in any institutions, or in the club, so that there is a persistent activity going throughout the year. So, sir, I would just request your comments on these tobacco marshals and how we can actually leverage this in a bigger platform. So, over to you, sir.
Thank you, Pawan. That's a very wonderful question. First thing I would like to correct that, even though health is a state subject and we expect the state governments to continue to implement the National Tobacco Control Program, we are also actively monitoring the activities of the states so that, the efforts does not end as intermittent efforts. It has to be a persistent effort. That's inbuilt in the program. And there are challenges, there are some hiccups here and there, but our intention is that they should be persistent. So for that matter, in the schools, we have Madam Preeti Sudan is also here. Ma'am's time we had released what is known as the National Tobacco-Free Educational Institutes. There we have a scorecard of 10, and as per the guidelines of the COTPA, as per the principles laid down in the National Tobacco Control Program, we are trying to make tobacco-free schools, and we have got various mechanisms by means of encouraging the schools to act on those parameters so that they remain tobacco-free throughout. So that effort is there, and it is picking up in many of the states. Meghalaya model is very good, and we already have an app which is also designed by some other organizations like yours, led by Samban Foundation, and many other states like UP as well as Karnataka. They are also doing very well in this. However, we are still yet to pick up in some of the other states. We are also working with them in whichever way they can implement tobacco-free educational institutes, they should be doing it. Tobacco Marshal is also a welcome group. It's a welcome effort made by your organizations. I see the enthusiasm in all the partners here, and I wish them a success. Tobacco control is not one man's job. It's not even health ministry's job. It has to be an all government approach, like the way we do for COVID-19 pandemic. So it is for all of us to work together. Like in any disaster, you know, we need all the stakeholders to be working in tandem, in sync with each other, complementary to each other, rather than, you know, competing with each other for that. So for that matter, Tobacco Marshal I see as a positive hope, but it's with the efforts of the government and efforts of all other organizations working for the same cause.
Thank you so much, sir. Exactly, that's the we have to each person working in the society have to complement the work that has been put forward by the government, and that's where the NGOs and the people in the civil society comes in, and that's where Sonal Bhatia, who took up this tobacco marshal and making tobacco marshals amongst the Inner Wheel Club, has become a very a program which has shown results extensively. So thanks so much, sir. And it's a really heartening to hear that yes, tobacco marshal is something that is really making a dent in the society by just donning the cap of a tobacco marshal, by empowering the people and training them. Actually, that creates that the feeling that yes, they can do something something more in the society, and that's where we are also looking at creating such tobacco marshals in the school. Like we trained some of the teachers in the school, and how if we have what we found that when we have trained teachers in the school, we have some persistent activities going around in the school regularly. One of them has been Dr. Pravesh, who is working in one of the institutions, and she has been she was the first teacher tobacco marshal in India, I would say, tobacco marshal in India. And she has actually brought a change in her institute. So if I can ask Dr. Pravesh, how do you look yourself as a tobacco marshal, and you are working in the institution as the first teacher tobacco marshal? How do you feel that, yes, this is something that has really make a difference in your life and in the institutions that you're working at?
Thank you, sir. My greetings to everyone. It's indeed a great privilege to be honored with India's first tobacco marshal. First, being a tobacco marshal, I would say I can contribute better than before, as now I am empowered and equipped with right knowledge. Secondly, I would say by profession, I am a teacher, and we all know that teachers not only guide students in their academics and extracurricular activities, but teachers are also responsible for shaping child's future, making him or her a better human being. So especially teacher as a tobacco marshal can contribute better and keep the students at bay from tobacco abuse. And this I can feel that because when I ask my students to organize some activities or the things that I want to conduct in my college, they enthusiastically participate in that, and even they sometimes they share their experience, what they feel, like peer pressure and all that. This is happening in my college because peer pressure nowadays is a big concern. So they share such kind of things. Even those students who are working with me in my club, they are bullied by what you are doing. You are doing just a ek prayas, come and taste for one time. These kind of things are happening, and the students share these things, and then I get to know that how I can proceed further to overcome such kind of things. And sir, if I talk about my contribution to my college where I am working, I would say I am fortunate enough that I always have the support of ICanCaRe team all the time, and thankful to the management of CARE group of institutions that they thought deep down about this tobacco epidemic and initiated the Club Ek Prayas. through which we have organized various sensitization and awareness program at college level and also at national level in collaboration with AICT and ICanCaRe. The impact of all these activities that many of students came forward in the support of this mission, Save the Youth. And lastly, I want to quote that, sir, the two great movers of human mind are the desire for good and the fear of evil. If in youth, if we are able to create that fear of ailment that occurs due to tobacco consumption and let them know about the importance of health in their life, then it will definitely help to eradicate this evil from the society. Thank you, sir.
Thank you so much, Pravesh ma'am. And it's really to see women empowered and doing something in the society is really something. It's what you have started, what Sonal ma'am have started. I'll put this question to Preeti ma'am, and I'll look forward for her comment. Is this the beginning of a bigger revolution? Dr. Swasticharan has said that yes, this is something required, and if we have the women empowered as tobacco marshals, means they can really bring a lot of change. That is what we perceive. And so we'll look forward for your comment, ma'am. And what should, this is another thing that has been very keen to my thoughts. What should a woman do when they find out about the tobacco habits of their partners? Because suddenly after the marriage, they come to know that the husband is taking tobacco. It becomes, it's really brings a complete disaster to that woman, right? Long-term disaster as well as short-term disasters. And again, how these women can bring a change in the rural environment against tobacco. So over to you, Preeti ma'am. We know that you have been working so extensively in tobacco and you have actually laid the foundations for tobacco control in India. So please, we'd like to have your comments.
Well, thank you, Dr. Saab. Frankly, I think if women lead, and I'm being partial, certainly it will make a lot of difference, because women think not only of themselves, they also think of the whole family and the whole community. So greetings to Sonal ji for taking up this initiative, and I'm sure that you'll make a lot of difference. Just want to add that, women have been leading globally and nationally anti-tobacco efforts. So there is a convention on tobacco control called FCTC of WHO, which actually came about during the time of Gro Harlem Brundtland, the former PM of Norway, who was then DG of WHO. And it was then two women, one Romer and Ellen Taylor, the latter was from University of Maryland, who actually initiated the idea of this FCTC. And then, of course, nationally, there was this, our former minister, Sushma Swaraj, who actually brought in during her time in 2003, this COPTA Act, the Cigarette and Other Tobacco Products Act 2003. So therefore, women have been in the forefront, and if they remain in the forefront, I'm sure that, we can prevent this menace from eating up our country, or say smoking, ending up our country into a smoke. That's what we should not allow. Well, then coming to the second part of your question, if you can please put it on the screen, I'll be grateful. I think the second question was, what should women do when they find out about tobacco habits of their partners? First is that, in a marriage, it's partnership. So first is that you must tell the man that passive smoking is extremely, extremely harmful. There is data, and I'm sure that that, passive smoking can lead to 20 to 30% more strokes, more, when you're a doctor, Gupta ji, that heart attacks, and then, cancers, and also it affects the unborn child. So the first thing is that, you know, the ill effects of smoking by a partner, smoking by a husband have to be highlighted. And we do not have any law which prohibits actually smoking in private places within the walls of your home. We do have, as you know, under COPTA section 4, which prohibits smoking in public places. And of course, as you know, prohibits advertising, and you know, we have these clips, anti-tobacco clips before movies. We have all those under the COPTA Act. So a woman should actually make it very, very clear that the smoking habits of a partner can not only be hazardous, harmful to them both, but also to, say, as they extend their family to the unborn child. That's one. Next is, of course, you see, if things go beyond a point, then women can, you know, it is harassment also, because we've seen that some men can harass women through their smoking habits. Certainly, then they can go ahead and, you know, seek law that they are being tortured, they are being mentally tortured, and all that under the relevant sections of IPC and CRPC. So this is what I would advise. But you know, the one thing that works, and I find that Indian families, where our family system is still very strong, it is family pressure. So therefore, a dialogue or a persuasive, you know, I would say conversations can make a difference. And yes, I also feel that we should be very upfront in asking whether you know, a prospective partner or husband is a smoker. That should be asked, because it's very important. Because especially I feel that increasingly, you know, the youngsters are getting more conscious that smoking is not good. And I feel very happy that our GATS surveys also show that you know, the prevalence of smoking is going down, but amongst women, you see, there is a slightly increasing trend. As I think Sonalji also said, that you know, people think it fashionable. I feel very proud and I feel very humbled that, you know, during my time we could put a ban on e-cigarettes, which could have become such a big menace in our country, because given our youth population. So therefore, I'm sure that, you know, this coming together to fight the menace will make a difference. Then you asked about rural areas. Frankly, Dr. Saab, I feel that rural areas are easier to work on. And you know why they are easy? Because there is homogeneity, there is more community feeling, and we need to have gram sabhas around tobacco. And as your Inner Wheel is taking up trainings, they are taking up, you know, their MARSHALs are coming up. Let me cite an example. There was a time when the world thought that, you know, this menace of AIDS will actually finish India. But you see, we came out of it. We are now not only, and it was possible only because of community connect. And now we are trying to fight TB also through community connect. So wherever you have a community connect, wherever people get together, wherever, you know, efforts of one translate into efforts of many, there we can make a difference. So in rural areas, you must contact the sarpanches, you must have special gram sabhas. Your Inner Wheel can go there and talk to, you know, the self-help groups. We have so many women self-help groups. So the urban women should connect with the rural women, so that, you know, you are strengthened and they are strengthened and all of us are strengthened. So therefore, it's a very good move. And let me share with you that since I saw on screen that from CBSE also some director is here, that there is this health and wellness program under Ayushman Bharat, which we have initiated along with Ministry of HRD. So, there are 2 health and wellness ambassadors, which means 2 teachers in every school who are supposed to every week give, education on preventive and promotive health to children. And tobacco is certainly a part of that. So your marshals should also discuss that with the school principals and the teachers. And, the impact will be huge. Because in schools and in our homes, if we can motivate our children never to take this up, then I think all of us are safe if our next generation doesn't smoke. Thank you.
Thank you, ma'am. That's a wonderful input. Actually, I can see Sonal ma'am smiling and seeing that yes, she has got much more to do now. She has got the sarpanches. She needs to connect. She needs to connect to the teachers. Yeah, but the most important is that the women are the most important behind, and they can actually bring the change because they are thinking about themselves, their families, their next generation. Next generation is actually, so actually when we are talking about tobacco marshals, ma'am, we had 5 things that we put for tobacco marshals. Number 1, be smart, do not start. That is promoting among the children that be smart, do not start. That is number 1. Number 2 is win over tobacco is easy. That is what we want to again put it in front of others, that yes, it is possible to quit tobacco. We need to do it properly, and that is where we want to put to all the women that if your husband, if anyone in your family is taking tobacco, please take medical help, the right medical help, so that they can be easily brought out of this tobacco. Number 3, very important, be careful and fearful. That is what we put it, ma'am. Be careful and fearful. That is, be careful of the people taking tobacco around you, because they are going to cause your second hand, third hand, and fourth hand, and they will put some type of peer pressure which will actually induce you to take tobacco. And that is where we tell all the people, be careful and fearful. And specifically I tell to all the women, definitely ask your prospective spouse that is he into tobacco, right? And if he is, then better to say no to him or her rather than go ahead and get into the social pressure. And the 4th is capacity building. That is, ask more and more people to join in. And the 5th and the most important, and forcing tobacco-free zones around that area, and to start from their home, then surrounding their institutions, their workplace, so that small pockets of tobacco-free zones will actually make a lot of difference. So I think, thank you so much, ma'am. We move ahead, and we definitely have Dr. Biswajit Saha, ma'am. He's the director at CBSE. So we'll have we look forward for his inputs also, sir. Sir, welcome, sir. And we definitely, like ma'am has said, Swasti sir has also said, and Dr. Biswajit also believes that we need to have specific tobacco marshals or tobacco persistent intervention in the schools. So over to you, sir. What are the challenges that you are facing? Because you also have a mandate. We have heard you earlier also. And how can these tobacco marshals be an answer to the challenges that you are facing? Over to you, sir.
Yeah, I think first of all, compliment to your organizations, Dr. Gupta. And of course, I was listening Madam Sudan and other dignitaries. So for school, definitely not always it is a challenge, but until class 8, absolutely no challenge, because student may be oriented towards that, and Indian culture and ethos is somewhere driving the entire nation. So until this particular age group, maybe especially age group till 12 or 13, even some of the families are really exposed with tobacco, and along with in the northern belt, definitely the alcohol. So that cultural issues are actually somewhere influence the household. So this becomes a peer discussions in the school, and especially in the classroom. and gradually it takes a load on them, especially when they reach to class 9 and 10. Then some of their classmates, if takes as a habit, then that copy-paste model and followed by the media industries is definitely a challenge. And now issues in the campus, out of campus, issues in household or out of households in the vicinity. Now the moral responsibility of the parents, one way, because if individual parents is consuming alcohol and also using tobacco, now all these cultural issues are there, but how he or she can influence his kid? So that is a big challenge. But for the schools spaces, definitely these tobacco marshals can play a big role, because many of youth tobacco marshals, maybe some of them, very selective few, are teachers, but if some of them are parents whose kids are very much enrolled in the school systems, they can spearhead, and ultimately whatever challenges schools facing out of campus, that can be definitely balanced out. And number two, with respect to as a part of the civil society, how? Because of course, to meet up the international standard and all, including Delhi airports or other some of the other airports, the smoking zone. Why that special zone? Because Preeti ma'am was telling about banning issues of e-cigarette and how country has benefited out of it. I think these kind of policy decisions also we need to look into. No matters how the smokers are going to suffer due to the non-availability of this, but I think so we are keeping a special arrangement for them. Is it a health indicator or promoting a kind of a culture in the ecosystem, so that there are a facility available, one can smoke? And whenever these peoples are coming out, even I have experienced this in Delhi airport, while going boarding flight, near that smoking zone, whenever anybody enters or to that room or coming out from that room, naturally these smell are affecting the passive smoking issues are very much vibrant there. So I think if it is at all need to be there should be special arrangement. Otherwise, I think there is a violation of standard. So atmosphere and ecosystems, whenever giving that kind of encouragement, that becomes a challenge for the educational institutes. And no matters what way the tobacco marshals teachers are going to explain them, it becomes a different kind of attributes. So internally, I think school or other educational institutes need to have a positive parents interactions, so that their issues can be addressed at individual level and also at group level. So, and organizations like yours and others who are actively involved, and of course, as Madam has rightly mentioned, that under the Government of India's different flagship missions, CBSE is also very much part of it. And we are trying to promote, and especially our mechanisms is, we try to connect with our teachers first, and through teachers and school leaders, we try to effectively reach to the student community. So I think if any answer of any question is left out, you can please mention it.
No, sir, it's absolutely fine. And I think you have put in the very important pertinent points that are out of campus, inside the campus. It is very important that people really work for together. And this is where actually what we saw, that when Pravesh ma'am, she as a teacher, she started working in her institutes, she could really bring a change both inside the campus and outside the campus. And as a tobacco marshal, when she was persistently available for the student, for anyone, even for the parents who could come in, that was actually making a lot of difference. And this tobacco marshals who are present in the school campus itself, they help in creating awareness and also in guiding the students, specifically those students whose parents or who are exposed to tobacco at home because of whatever the reasons. So it becomes a very, very important, and these tobacco marshals are just not ordinary people. They have been trained. They have been trained how to communicate, what to talk to the people, what to talk to the students, how to address the issues. So they are the trained people, and just talking about just that tobacco is bad is not enough, but talking intelligently and not giving sermons, that makes a lot of difference. So thank you so much, sir. I think this is very important that you said we need to have tobacco marshals in the school where these students and others can be guided on a regular basis on a persistent effect. And of course, the 10 points that has been given by the government, that should be included as a part of the tobacco marshal program, that yes, this particular school is a tobacco-free school. That can be implemented. And I really thank you so much for your input, sir. I'm sure this is going down to almost 150 people who are here. That yes, and a lot of the Inner Wheel members have got schools, and they're the teachers in the school, and they are owners of the schools. So I think this will be a big information or something very important, that yes, they can take up such projects and make sure that three things that I said: be smart, do not start. That is something we can start from class 8 onwards, as you said, and take it ahead so that no one actually gets into tobacco at all. And even if there is a lot of external pressure and peer pressure. Thank you so much, sir. I think we will go ahead, and I thank you for being here. Shruti, I think we have got some special spin wheel something before a small break, and I think please go ahead.
Yeah, thank you so much, sir, and thank you to all our esteemed special guests for giving the remarks and for really appreciating the efforts by the team which has been done for taking the tobacco control activities with the hands of tobacco marshals ahead in the society. So here's a small activity. So we have spin the wheel. So यहाँ पे क्या है? 100+ clubs names are there, and I'll just let Sonal ma'am if somebody would be coming up to spin the wheel, or should I just go ahead? Ma'am, you're on mute.
Go ahead, Shruti.
Okay. Thank you so much, ma'am. So I'm just going to click on this link. This is a small wheel which has been created. My laptop is hung. Sorry. So a small wheel has been created. Now this wheel has the names of all the clubs, and when I tap, it spins, and when I tap again, it stops. So whichever club name, wherever the pointer stops at the given club name, that club gets the opportunity to nominate 2 members to participate for the tobacco marshal program at 100% scholarship. So here I start the spin. And I'm stopping now. Name, I'm noting this name. So the 2 members from this club have the privilege to win tobacco marshal 2 seats for tobacco marshal at 100% scholarship. So can we move ahead?
Shruti, please. We have Dr. Sunila. She is an extensive. She has been working extensively in the community. She was professor at Maulana Azad Community Medicine. So, ma'am, having heard all this,
we'll request others to please be on mute.
Yeah, please keep. Yeah, Sunila, ma'am. So we are looking forward for your inputs on. The community is full of talented women, like we can see in Sonal ma'am and the whole team. You know, in one of the pictures, you know, when these girls had shown themselves, they were looking like all ugly-looking faces and all these things. They were doing all this lot of activities in the society and have created a ripple in the society. and some were giving some nukkad natak, some were doing some drama, some were doing some have even put in some songs and all. So getting this community together, the talented women together, how can we streamline and leverage their intellect to create mass impact for tobacco control? Ma'am, this is your special area, and we have been working extensively. We look forward for your inputs, ma'am. Sunila, ma'am.
Thank you, Dr. Pawan Gupta, and good morning to all from USA. And it's been really my pleasure and honor. And thank you, Sonalji, for leading the whole campaign. And I was listening to Dr. Swasti and also Madam Preeti Sudan, and also I listened to Dr. Saha, and it comes at a very appropriate time, this topic, because I have been working with 3 countries, India, Bangladesh, Pakistan, along with 8 universities of UK. So you see, my, first of all, the perception at the community setting, coming to the first question, that is that, what can we do in the community settings? Now, we have got varied kind of communities. India is very diverse. We have got rural population, we have got urban population, we have got urban slums, we have got tribal areas, something like, when we were working for COVID, we realized one size does not fit all. So tobacco control strategies also, whether in smoked form or in smokeless forms, one size is not going to fit all. So we have to identify what exists at what places, because community has a lot of potential, but, we also have to see, and women have a lot of potential, but we do talk about male partnerships as well. So coming to that, we have to realize that we have, resident welfare associations, we do have, in Gram Sabha, Panchayati Raj institutions, we have women self-help groups, and also you see we have a big power in terms of, village health and nutrition days where, our Ashas and Anganwadi workers are working. Besides it, we have to leverage every person. That is important. So you see, women power is important, but we do have to talk about the male power as well. So because unless you sensitize the community as a whole, it becomes very, very important. Because Dr. Pawan, I would like to share one experience, because during, our odd days in Delhi, when there was a lot of pollution, we went for checking the, doing the lung function assessment also. And we realized that 1/3 of the women were, lung impaired because, they were suffering from passive smoking. So unless, the directives, first of all, they themselves have to be empowered in the community setting, because the base of any program starts from the community. So we have to realize that, in the community setting, unless, the message reaches the last mile. We have now 117,000 health and wellness centers where we have, our community health officers, our multi-purpose workers, and then we have link workers in form of Ashas and, Anganwadi workers who are linked to the community. So the message has to go to 360 degrees. And again, involving, the private clubs like Dr. Sonalji has already done this initiative that, one size does not fit all. As I'm telling you, it's a kind of a snowball technique where, you talk to 1, you talk to 5, you talk to 10, and that's how you create a chain. But then, this will work for one area, but when we go to the rural areas, we have to see who are the key informants within the community settings, who are the influencers within the community settings. Is our Gram Sabha or Gram Panchayat ready to listen to the change? So this is where it is very, very important. And again, please remember, now we are talking of end game tobacco. That is, we have already started talking of that, because already Madam Sudan mentioned about the fact that, the GAT survey has shown a decline, but then, it is something we have to make a persistent and consistent effort. So you see, it is very, very important to empower each and every woman, and even beginning from schools. When I was listening to Dr. Saha, my own experience is very different. We did just one study in 6th, 7th, and 8 children, and, they were into smoked tobacco. They will not do openly, but smokeless tobacco is consumed in various forms, even in school children as well. And they will say, and some of them, they said that they saw their teacher also doing that. So that is where we have to empower our change makers into that whole thing. We should not say that, teachers, have they ever talked to the children? Have the talks to the parents? That is where, we have to involve everyone. But, mother is a big change maker. So we have to take everyone into consideration. And That's how we can make a change. But as I said, that we have to go for a 360-degree approach. We have to have a kind of print media, we have to have a digital media, we have to have nukkad nataks, we have to have, so as I said, one size will not fit all. India is very big, very diverse. We have, now luckily for us, we have got sex ratio, which is now, in our favor. It's gradually increasing for the betterment. So we have to see that ultimately we have to involve every woman and reach to the last mile, but understand the communities. What are their perceptions? What do they think about that? Do they feel that it is all right? But quite a number of times, the response will come from the women themselves. It's okay for the women. So okay for the men to smoke. So it is important that let them realize, it is very, very important to understand the consequences of smoked and smokeless form of tobacco. We see a lot of stillbirths, abortions, and premature deliveries because of even smokeless delivery, smokeless consumption of tobacco, which goes unnoticed. So that is where we have to talk of both smoke and smokeless form of tobacco. We have to even intervene in all the institutions which are meant for women, which are meant for, there are, co-ed educations, but then community settings become very, very important for us. So it is important that we all, kind of join hands together and sit and address a woman who is sitting at the last mile of Chhattisgarh or at Bihar or, at Uttar Pradesh. And we have to make use of, now the time has come that please make use of health and wellness centers, women's self-help groups, Panchayati Raj institutions, resident welfare associations, so that, we can reach the last mile. So we have to talk of end game tobacco now. And people were thinking that, is it too early to talk of end game? I said, never, it is too late. You start talking now and you have your targets. And Sonalji, I will be very, very happy if we have concrete monitoring tools kind of, because one woman will sensitize 5 and then 10, but ultimately we have to make a persistent effort so that every woman, kind of sticks to the same behavior change, and not that over a period of time because of gender-based violence, which is also, kind of cross-cutting thing. So we have to see that, that she keeps her voice steady. She's aware of the side effects of tobacco. She's aware of, because quite a number of times I'll say that as a doctor, we have seen that, elite women do come to the private sector clinics. They'll say, doctor, please tell us everything, but don't tell us to stop smoking. She is carrying a baby in her womb. So remember that we have to be firm, we have to be persistent, and we have to be consistent in our efforts. And these are very, very laudable efforts. We started with baby steps, and look at, 1 year down the line, I can see a big chain of moment when I was there in this, when we started this seminar. And Dr. Pawan, I think hats off to you for taking this whole thing forward along with Sonalji and all her team. So it is very important to look from this perspective, and we are all there together in this venture. And coming from the community settings, and I can see Dr. Paramita also, we know that we have rural centers, urban centers, and we have got so many medical colleges. Each medical college should carry this message in the community settings, in their clinics, and empower our young undergraduates, postgraduates, so that whenever they go to the community settings, each one should be aware of the side effects of tobacco, and empower, not only aware, but behavior change has to come in. So our thoughts have to translate into action. Thank you so much.
Thank you so much, ma'am. That was really, really motivating words from you. And definitely when it comes from you, who has got such extensive experience in the community and has been doing so extensively against tobacco, from the grassroots level, you have been working, ma'am, trying to bring a change from the rural to the urban, to the schools, to everywhere. So I'm sure Sonal ma'am is now showing her all smiles and all highly motivated. What you started, Sonal ma'am, it is really laudable, and it is something that is needed for the society to fight against this, the most dreaded disease in the society. So hats off to you, ma'am, and for being part of this and joining in for this program. And all the way, thanks Sunila ma'am for coming all the way from USA She just woke up early in the morning. I woke her up actually. And thank you so much and for being joining from USA. It's 5:30 in the morning at USA where she is. And thanks, ma'am, for being there. So
Thank you so much.
Yeah, and we'll carry it forward. And here, I think I can see the wheel again. So we have got another. If you are there, please note that you are getting to have 2 tobacco marshals sponsored from our side. So it's a scholarship. So congratulations from full question.
Sorry, sir. I'll request please put yourself on mute.
Yeah, let me just. Yes. So I think we have got a poll question coming up, and that's a very interesting poll question. I think all the members here who are 131 who are here, please go ahead, come to the and give your answer here. The poll question is, you'll be sharing poll, Shruti?
I've shared the poll.
I can't see it. If everyone can see that. If a woman is made aware of the hazards of tobacco, just now recently the Sunila ma'am said so many hazards of tobacco, and it's just not preaching, it is making them aware, trying to make them learn about it. So on our health, how it is affecting our health mentally, emotionally, and physically, that the choices are that which you have to put. The divorce rate would increase, the domestic violence will increase, the use of tobacco amongst men would decrease, the future generation would be better, or disease control could be made better. So this is a poll question for all of you, please.
Yeah, I think now people can see the poll question.
Yeah, you'll have to unshare or something. Please go ahead and can we stop now? Can we see the results? I'm not able to see actually. You are able to see? Everyone able to see the? Yeah.
Yeah. Can you see the screen, sir?
I
With the
can
poll answers?
No, I cannot see that. But maybe you can read it out, please.
Okay, so 70% of the audience says that future generation would be better. 15% have voted for disease control could be made better. 7% have voted for domestic violence will increase, and the use of tobacco amongst men would also decrease. However, nobody has voted for divorce rate that would increase. That's the results of the poll question.
So that's great. Actually, that's the real feeling that yes, we need to do more. And the future generation is in the hands of all the women. So that is very important. And I think, and every woman here who is here understands that they need to become tobacco marshals. They need to understand about tobacco. And if they do understand about tobacco, the future generation, the present generation, all will be better. So we move ahead, and Dr. Prashant Kumar is there for Dr. Salini Singh. So Dr. Prashant, I'm going to put this for you. Can empowerment and education of women about tobacco lead to cancer and other NCD prevention, especially in the rural areas? What strategies should be adopted for large-scale effect? Can tobacco marshals help? Can there be studies to measure the impact of women education against tobacco for cancer prevention in the long run? Well, so there are 3 questions for you. Over to you, Prashant. And I'm sure you have been working so extensively he's the nodal officer at this thing. Just Prashant.
NTCP, sir. Yes, sir. Yeah, sure, sir. So hi everyone. I am Dr. Prashant Kumar Singh. I work here as a scientist B with the division of preventive oncology and population health, and I am also looking after the WHO FCTC knowledge hub on smokeless tobacco. So at the outset, I would like to first extend my warm greetings to all the tobacco marshals who have actually doing a tremendous job to actually control this this havoc of tobacco, and this has to be actually tackled from the prevention part, because what we are actually doing here is that we actually deal with prevention, cessation, as well as policy, and spending around 5 years here at the knowledge hub, what I have or our team has actually learned that tobacco prevention is much more impactful, cost effective, and have a large impact on the population, rather than diverting our major of the resources to the tobacco cessation. Because to be frank, tobacco industry wants us to spend more on the cessation, because they actually want to sell their products, and they actually want us to be involved in the tobacco cessation. So from my experience and my research, what we've actually learned is that prevention is much more cost effective, impactful, and less painful at the mass level. So that's number one. About the women, we have been extensively actually working on the smokeless tobacco and women aspects, and now and you would be actually surprised to know that on a very contrary, where majority of the women in the Western countries quit smoking during the pregnancy, unfortunately in India, many women actually initiate smokeless tobacco during the pregnancy. So it's a it's just a opposite paradigm which we actually see in majority of cases among the women during the pregnancy. So in that case, what we have actually learned is that at the community level, there is a large large part of unawareness actually plays a major role, because to some extent the frontline health workers are also not very much aware about the different aspects or how the smokeless tobacco actually impact both women as well as their newborns. So there I actually feel a huge scope for all the tobacco marshals to actually reach out to the frontline health workers, and through that we could actually have a major reach on the community. Because what we have actually learned from the reproductive, maternal, newborn, and child health program is that if the community being aware from the healthcare providers perspective, that actually has a major role to play in terms of uptake of the antenatal care, safe delivery, as well as postnatal care services. At the same time, what we have actually found in our ongoing studies is that women who actually quit during the pregnancy, they immediately starts during the lactation. So that's again a issue which we are actually dealing with, and that actually requires a great amount of effort from all of us in terms of tobacco control. So the next question, which actually asks about the large large impact of the tobacco control, and there what I could actually see is scopes at the institution level. Like, for example, we are now actually in a verge of having a pilot study with Uttar Pradesh State Road Transport Corporation, and there what I think is that if we can actually have one tobacco marshals at each of the bus depots, that has a major impact on bus drivers, conductors, and those who are actually involved in the tobacco, and just be mindful that they are the huge burden. Like what I mean is that the prevalence among these, certain sections of the population are 80 to 90%. And if we intervene, the prevalence can immediately be addressed at a very large, level. So these institutions could be very easily addressed in terms of, like tobacco marshals. So what apart from being as a women tobacco marshals, we can have one idea of, male tobacco marshals, where in those institutions like bus depots and all, majority of them are actually involved in some form of tobacco. And in our study, they have actually very categorically said that their dependence on the tobacco has actually increased over the years, as they have very clear instructions that if they have found being alcoholic during the services, they would be actually removed. So their harm reduction, or their alternate way of being very active at the office is they are actually started various kind of tobacco products. So that is the gap which I could actually see a hope. Now, last point which I have in mind is that let's not actually forget about the areca nut. and their majority of the women in India are actually the consumers of areca nut, and areca nut actually considered to be a class 1 cancer causing product. And in many of the studies we have actually found is that the first product of the tobacco users, and particularly among the smokeless tobacco users, are areca nut. So they actually start or experiment with the areca nut, and they actually go with or they actually progress with other products. So what I would actually request you all to also capture the epidemic of areca nut apart from or along with tobacco control. And the last question which I could actually see about whether women can be empowered through can there be studies to measure the impact of women education against the tobacco. So to be honest, there are two schools of thoughts. One actually says that if you educate, if you increase the education, the tobacco use actually declines. But at the same time, a few studies have actually shown that education led to some extent increase in the tobacco use in higher pursuit of achieving empowerment or autonomy in a male dominant society. So we have to have a very thin layer between the education, awareness, and what is the role as such for us individually at the family or the community level. So what I feel is that apart from having a focus on the formal education, there has to be a awareness or education of being as a responsible citizens of the society, and that to me would help a lot while achieving the no tobacco society in our country. So if you expect any more thing, then I actually would be happy to.
Thank you so much, Prashant. It has been an extensive and a wonderful input. I think you covered up everything from areca nuts, from pan masalas to all the other aspects that is required in for tobacco. And something that is very important that you said, responsibility. And this is what Sonal ma'am had in the beginning itself said.
Yeah.
And responsibility should not be that we should not be passing on the responsibility that it is the government's job, or it is that job, or it is their job, or it is someone. Taking responsibility, that is what two things that I always say. Taking responsibility or giving responsibility. When a person takes responsibility, that really makes a wonderful change, because they are highly motivated and they are going to bring the change. when you try to force responsibility on someone, definitely you can expect that the work will not be done. So this is where actually the tobacco marshals are there. The tobacco marshals take responsibility and they are doing extensive work in the society. Now, Prashant has actually put forth that it is just not the women, it should be the male also who should be tobacco marshals in the society. We should have every organization for that matter, there should be tobacco marshals, right? So I thank you, Prashant. I think, and this is where something again, I want to put it to everyone that yes, we need to have more and more tobacco marshals. And as I said, Prashant, we need to have some institutional study to look at that. Yes, is there an impact of tobacco marshals in the society? So we'll definitely discuss on that if we can really work out how we can see that if we have got 250 tobacco marshals and almost 1,000 tobacco marshals that Sonal has created, is it actually impacting in the society, right? So thank you, Prashant. And I can see the wheel again. So this is the last wheel, I think. So please go ahead and I think. Wonderful, congratulations, Moradabad Essence. So you have the chance of having 2 tobacco marshals from your club. So thank you so much. And if you are there, then please, we will look forward for you to nominate 2 people from your club. So this is another wonderful question. Pre-marital check of tobacco use is a must. Agree or disagree? So this is again a poll question and it's very simple. Today, actually, Preeti ma'am had just put this thing. So here is the question. Pre-marital check of tobacco is a must. Do everyone agree or disagree? We have got 120 people still there. So please go ahead and put your, Shruti, you have put the poll?
Yes, sir, it's put on.
Yeah, let's see. I hope we are going to get 100% answer. I cannot see the poll, so please let me know the answer. Can we stop now?
The 95% have shared from the audience that they agree that premarital check has to be done, and only a 5% disagree that it is not required.
So 95% agree. I had thought 100% would agree, but still we need to have sensitized this rest of the 5% who probably are still sensitized towards tobacco. We have to desensitize them towards tobacco and make them more sensitized towards tobacco, because everyone in the society is suffering because of tobacco. And a girl, when she gets married to a tobacco user, she definitely suffers throughout her life. So without taking much time, I think we have got the last panelist today. So Dr. Paramita, can we request your input? Dr. Paramita, if you're there, please. Dr. Paramita is again a community medicine and she's professor at AIMS, one of the premier institutes in India, AIMS Kalyani. So what every woman must do in the community to fight against tobacco, right? And what role do a tobacco marshal play in the community? We already heard so much about from Sunila ma'am and other things. So just your inputs, how do you foresee? And I know that you have been very much interested in this tobacco marshal program, and you wanted to have this thing in your community in the district where you have been working extensively. So let's hear your input on that.
Thank you, Dr. Pawan, for giving me this opportunity. And indeed, I must appreciate all of you who are doing this marvelous venture, and especially especially Sonal ma'am. So great work, congratulations. So actually, we know that women-led movement influenced Andhra to reduce its liquor consumption. In 2019, Y.S. Jagan Mohan, he had to reduce it and he had to put a ban and all that. So women are the main power, and women's role as caregivers, because they are caregivers. And we heard from Sunila ma'am that mostly the frontline health workers, they are also women. So especially our Ashas, and then we heard from Preeti Sudan madam also, like about the health and wellness centers. And particularly in the health and wellness centers, I must tell you that there are CHOs who are posted there. CHOs are community health officers, and they can be leveraged to for this program because they are tackling with NCDs. And one of the NCDs is these cancers. And they are supposed to look into breast cancer and cervical cancer particularly. So while they're doing the training, they'll meet some people and they can do this thing in the community. Plus there are the ASHA workers, and since this is, everybody said that it is a multi-sectoral approach, so maybe, and political, for anything you need community mobilization, community interaction, and intersectoral. Intersectoral coordination also has to be there, and most important is political will. So if like ASHAs, they are given incentives for carrying out any work in the community, and as of now, what I know is that they are getting incentives for 45 such works, like village health and nutrition days, looking after the mother during her maternity period and all. So something like that can be given to the ASHA as well, like how many of these people she has been able to convince to quit smoking. So and she can also act like a counselor actually, because she can penetrate into the households of the population, I mean in the community. She has a direct access and people will listen to her. So these ASHAs can also be mobilized. And the women's role as caregivers, we know that it can be leveraged to support demand-side interventions for tobacco-free households and communities. At the same time, again, as I told you previously, women's voice must be amplified in the areas of science and policy making. So there has to be some support as well. So potential for healthcare providers to provide tobacco cessation counseling and support, especially by women, may be incentivized, and this can be made into a big government policy. And dialogue is also easier for, and we have seen that some of the studies, they have shown that women, because women are now more into smoking, especially the urban women, and if the women can be marshals, like they can counsel themselves as well, they can counsel others as well. So particularly self-help groups and all these are consisting of women. So I think they can be a big boon to us, making them as women as tobacco marshals. Thank you so much.
Thank you, Paramita and Dr. Paramita. It is really lot can be done, and I think
yes, we can do that study and we can prove, because nothing. People won't believe you unless you back it up with evidence. And you have already collected. And one thing I would like to ask Dr. Sonal ji, like how many have actually left the smoking? Like any like rough estimate?
Not estimated, ma'am.
December 21 you started, right?
Let me put it this way. Actually, Sonal ma'am will not know. At least I know 3 of our tobacco marshals whose husbands were taking tobacco, and they have called me and they have actually taken my guidance, and they are now out of tobacco. So
very good. So we have to back this up with tobacco cessation clinic also, like because when they come out of this tobacco, they will need some of them will be dependent on this. So some of them might be needing some medical help also. So yes, that they are totally cured of this. Yeah, so we have started in AIMS Kalyani, we have started this tobacco cessation clinic in our community. We have one in the OPD, AIMS Kalyani OPD, and we have just started it in the community, so that we can actually, everything is done in the community itself. And one of the ASHA worker has asked us to counsel her husband, and she had brought him to us. So
yeah, I think that's very important, and that's the essence of Save the Youth campaign. You know, SAVE. First is sensitization. If we sensitize, there will be a lot of persons who want to quit tobacco. So we need to have the assistance program. So the assistance program is now available, as we know, by the government of India. They have got the government quit line. which can be really taken care. But at the same time, at ICanCaRe, we also started a quit line, and we are setting up tobacco cessation centers across multiple private centers, as well as we are setting up centers in virtual centers. So this is also an important aspect. Of course, the V is the volunteer training, and we have started a sensitization and a training program for the doctors. The biggest problem with the tobacco is that we do not have trained doctors who can actually help people to quit tobacco. So I think that was a wonderful Paramita, Dr. Paramita, and I'm sure if we can take up this issue, and if we can take up this as a study, that how tobacco marshals are actually creating are impacting in the society, maybe that can be leveraged at a higher level. So I think we are coming to the end of the program, and we have got representations from Inner Wheel Club, and oh, that is a small skit. So I think we will just have the skit, and then we will be requesting our Inner Wheel specific members if they can representations how to Lord Sonal, how she has been doing and what we can do further. So just look at the skit. This is a wonderful skit.
जगह पान मसाले कैसे संभाला जाए, ये पूरा दिन लग जाता है इसी काम में, समझ में नहीं आता कैसे संभाला जाए, कितना घातक होता है ये सिगरेट के लिए। हर जगह सिगरेट, हर जगह पान मसाले के पैकेट आज आने तो पहले यही बात हो, बाद में
अरे भाभी जी कैसे परेशान हो?
बैठो परेशान क्या, पूरे दिन देखो पान मसाले और सिगरेट पे ही काम समेटती रहती हूँ, कुछ और काम ही नहीं है। जब देखो सिगरेट पी लिए, पान मसाले कर लिए, ये कूड़े इकट्ठे करते रहो, अपने साथ साथ हमारे साथ साथ अपना भी नुकसान कर रहे हैं। हर समय यही चीज खाते हैं, सेहत पे कितना नुकसानदायक है ये चीजें।
सही कह रही हो भाभी जी, है तो ये नुकसान वाली चीज है। आज एक काम करो, अगर भाई साहब आते हैं तो उनसे पहले यही बात करो, क्योंकि इससे बच्चों पर भी बहुत ही बुरा असर पड़ता है।
आप विश्वास नहीं करोगे, पूरी रात बच्चे घर नहीं आते हैं, यही पता नहीं किस संगत में बैठने लगे हैं, पूरे टाइम उनकी जेब से भी यही मिलता है, कभी पान मसाला कभी सिगरेट। बच्चों क्या हुआ, रात भर घर नहीं आए, तबीयत ठीक है तुम्हारी? कहाँ रहते हो आजकल, किसके साथ रहते हो? बच्चों क्या हुआ, बोलो तो सही।
बच्चों सुनो तो,
आपकी यही आदत है जो बच्चों में भी लगती जा रही है, पूरी रात बच्चे घर नहीं आते।
अरे तो मेरे पीछे क्यों पड़ जाती हो बात बात पे?
आपके पीछे नहीं पड़ रही होगी, बच्चों के लिए कितना नुकसानदायक हो रहा है।
भला मेरा सिगरेट पीना और तंबाकू खाना है बच्चों पे क्या असर डाल सकता है?
बुरा असर डाल रहा है, पूरी रात बच्चे घर नहीं आते, सुबह स्कूल में
तुम्हें तो मेरा तुम्हें मेरा कोई शौक पसंद नहीं आता, मेरा जरा सा भी शौक तुम्हें बुरा लगता है। जाकर देखो दरवाजे पर कौन है।
अरे बहन जी नमस्ते, कैसे? बस क्या बताएं बहन जी, आपको पता है हमारे पड़ोस वाले जो पांड्या जी हैं?
पांड्या जी? मतलब पांड्या जी को क्या हुआ?
वो सिगरेट पीते थे और उन्हें कैंसर हो गया।
कैंसर हो गया सिगरेट पीने से?
इसीलिए तो आपसे कहती हूँ कि बहुत नुकसान की चीजें हैं ये।
सिगरेट पीने से कैंसर होता है? ये छोटा सा शौक कितनी घातक बीमारी हो सकता है, ये तो मैंने कभी सोचा ही नहीं था। भला एक सिगरेट पीना किसी की जान भी ले सकता है, ये तो मैंने कभी सोचा ही नहीं था। मुझे माफ करना सुनीता, मैं आज से कभी सिगरेट नहीं पीऊंगा, सिगरेट और तंबाकू को कभी हाथ भी नहीं लगाऊंगा।
चलो इसको आगे बढ़ने से रोकते हैं,
आओ मिलकर प्रयास करते हैं इससे लड़ने में। नमस्कार, वी आर फ्रॉम इनर व्हील क्लब ऑफ संबल सिटी। यह एक छोटा सा प्रयास उन परिवारों के लिए जो इसे एक छोटा सा शौक समझकर शुरुआत करते हैं और बाद में एक घातक बीमारी बन जाता है। सो विद अस से नो टू तंबाकू। थैंक यू।
That was a great message. How the women is suffering, खाली साफ ही करती रहती है घर का, plus how the male or whoever it is, how are they not aware about the tobacco and the problems that they're facing with tobacco. So this is a wonderful message by the tobacco marshals, and I think ये छोटे छोटे प्रयास जो हैं हमारे जब सोसाइटी में जो मैसेजेस जाते हैं उसका काफी ज्यादा इफेक्ट होता है, एटलीस्ट डेफिनेटली वो affect the people around them. So all hats off to Sonal ma'am and her team for creating this really a ripple in the society. So I now have the last question probably, and then we will have the winners that of the poster and the mimes to be displayed. So please दिल थाम के बैठिएगा, please जाइएगा नहीं, क्योंकि हमारे जो winners हैं उनको भी हम बताएंगे, और इतने सारे थे. तो मेरा questions अनुराधा मैम और वीना जी के लिए है. अनुराधा मैम, if you are there, please do switch on your video, and Veena ma'am, you are there. So what जो सोनल मैम ने स्टार्ट किया है, what do you believe is the faith of the lady whose husband is a tobacco user? We have just seen that. Why should a woman choose to be a tobacco marshal? How important is it for women to be tobacco marshal to fight the outrage of tobacco? So जो सोनल मैम ने स्टार्ट किया है, how do you echo her system, echo her thoughts, and what do you say about this thing? So over to Anuradha ma'am and Veena ma'am. So I think Veena ma'am मैं सामने देख पा रहा हूँ. So over to Veena ma'am first, and I think Anuradha ma'am, if she can switch on her video, then we will have her also. Yeah, Anuradha ma'am also.
Anuradha is there.
Yeah, Veena ma'am, you are going first. Anuradha ma'am. Anuradha ma'am. Okay, ma'am.
Okay. Okay, Veena, thank you. Just now, you know, we saw so many things, we learned so many things. I had certain things in my mind. I mean, simultaneously, there are so many things going on in my mind. Of course, yes, the woman whose husband is a smoker, she can see, women are influencers. You see all the advertisement everywhere, you see a woman influencing something. So why not here women can influence? What I think people accept and believe what women say because they say it from the heart. And I just had one thing in my mind that see, at many public places now smoke. So we are having smokers rooms also. So maybe somewhere, you know, what Inner Wheel can do is we have 52,000 strength, 52,000 ladies, 52,000 families are there who can join this movement at a national level and become this tobacco marshal. And public places where we have smokers room, somewhere, you know, we can put this because like you are entering the death zone, or welcome to the death zone. Are you sure you want to enter? So, you know, these things also will create a massive impact on the people who want to use those public facilities for smoking. So this is what I have to say. And I really congratulate Sonal that she's doing really a good job by joining Inner Wheel into this.
Thank you, Anuradha ma'am. Thanks a lot. Thank you, ma'am.
So now we have Veena ma'am. Please, over to you, Veena ma'am.
First, I would like to congratulate Sonal for extensively working hard to make 1,000 tobacco marshals in all over India. First, I would like to congratulate Sonal. Then, tobacco marshals can play a vital role. Women tobacco marshals can play a vital role. Tobacco marshals are the savior of the society against the most dreaded diseases. So, in the world, killing crores of people, mutilating many others, widowing and orphaning a large number of youth. That is, we have heard from so many doctors today how to get out of the tobacco. So, a woman, what can she do to bring a visible change in the given region? A marshals can get a visible change in the given region, creating pockets of tobacco-free zones. We have to create pockets of tobacco-free zones, changing tobacco from socially acceptable norm to a social outrage. A marshal at each and every corners to influence and encourage individuals to quit the habit and prevent the youth from starting the habit. Large number of people who would be vocal about the harms of tobacco and can talk with determination about establishing a tobacco-free community. What Sonal is trying to do now, I'm seeing from last December, she's working very, very hard to create in the social media about the free zone for tobacco. Congratulations, Sonal, for that, because whatever the projects you have done, it has been in the association, the wide of India and even in the international. In the international website also it has been showed that the tobacco-free India from District Chairman Sonal Bhatia has been showcased in international also. So every woman has to be a tobacco marshal to control the tobacco outrage. Empowering every woman as tobacco marshal in the way forward to control the tobacco epidemic. Each woman needs to be empowered with the knowledge about tobacco to protect self and also the future generation. Thank you, Sonal, for giving this opportunity, and I'm very, very glad I'm the part of this project. Thank you.
Thank you, ma'am, for giving your time, ma'am. Thanks a lot.
Yes, thank you so much.
Thank you so much, Anuradha ma'am. Thank you so much, Veena ma'am. And this is something what I can say is the essence of Inner Wheel. And what both of you have said, every woman has to be a tobacco marshal.
Yes.
They become tobacco marshals. And Preeti ma'am also had the same words when she had said that women have to lead the way. Preeti Sudan ma'am, she said that we have to lead the way. So I think that is reverberating, this is echoing, this is reflecting in each of you that yes, what Sonal ma'am has started is going to be it is just the beginning, and we have got 50,000 women, Inner Wheel women. If all of them become tobacco marshal, definitely it is going to be something very, very means I'll say it is going to bring the change not only in India but in the entire world. The biggest killer can be really tamed only by one group, that is Inner Wheel group, and they join hands together for this project. So thank you so much, ma'am. And before we come to end, I think is Preeti ma'am here? Preeti Gurunagni ma'am, is she here? Actually, she had joined in between, but I think she has dropped off.
Yeah, I am here. Are you talking about Preeti Sudan? Then
Yeah,
I am here.
Oh, thank you, ma'am. Thank you, ma'am. Thank you so much, ma'am. And I think we'll hear your word before Sonal ma'am's word. Sonal's, she is going to complete her term very soon. Ma'am, having heard all the discussions today and the excitement and all the enthusiasm that we have in this Inner Wheel group, the ladies, we want to hear your last words, ma'am. Preeti Sudan ma'am, if you can put your word on this.
Thank you, Dr. Saab, and thank you to all the wonderful ladies who are here. Each one of you is a leader. And of course, I work quite closely with Professor Sunila Garg. She herself is an amazing leader. And the best part of this group is that each of you is an influencer. And you have taken up a very, very important noble task of motivating people to give up cigarettes, to not to take cigarettes at all, and to support people who would be willing, to in our endeavor to spread the message. So these three things are very important in my view, and I can see Doctor from Kalyani. I'm so glad that she's also here. Kalyani AIMS has come up during my time, and I must also tell that we have Ashas already under the tobacco program. We have a community-based survey being done by them, because now under health and wellness centers we do these preventive checks for oral cancer. So therefore, Ashas are sensitized. Most important is that, you know, we need to have community leaders who can talk about this issue again and again, because you see, public memory is short. So therefore, to work with communities is important. And congratulations to Sonal ji, to all the great, beautiful ladies here. My best wishes to all of you, and I am sure that you'll make a difference. Thank you for having me. Bye-bye.
Thank you so much, ma'am. Thank you, Preeti ma'am. And I'm sure this tobacco marshal, which has been started, will go a long way. And I think it will be accepted across, and it is a complementary to what is being done. And I'm sure it is going to make a lot of difference. So thank you, Preeti ma'am. I'm sure, and thank you for staying for the entire session and listening to each and every aspect and giving your words of wisdom. Thank you so much, ma'am. And last but not the least, now over to you, Sonal ma'am. Right, before we declare, and I'm sure you are going to declare the winners. So Sonal ma'am, your term is going to come to an end very soon as a DC. How do you foresee your future as tobacco marshal, or as something that you will be doing in Inner Wheel Club after you have completed your term as DC?
Sir, thank you, sir. Sir, I started brick by brick, which gathered momentum and now can see its flourishing. After all, nothing ventured is nothing gained. We have had a good start, and as it goes well, begun is half done. I would request all of you to join hands, come forward and be the change our nation wants us to be. We all really have to break new grounds and achieve the impossible. It's still a long way to go, sir. This project is very close to my heart, and I will always work on it. Forever, I will work on it. The results are quite apparent, as you can see in these slides, which you are going to show. We have not yet displayed our slides. We can see the slides. Our Inner Wheel marshals are working on war putting and reaching out to greater part of society to achieve our targets very soon. We are going to achieve our targets very soon. As I told, this project is very close to my heart. I wish to transform each and every member of my esteemed organization into Inner Wheel Tobacco Marshal. All 52,000 will turn into Inner Wheel Tobacco Marshals in future, so that we can achieve this mission of tobacco eradication at the fastest pace. I would request coming DCs also to continue with this project. I request all DCs of India to adopt this program in their districts and clubs, as it will be very beneficial and go a long way to achieve our aim of eradication of drug abuse. This is my wish, and this is my dream project, which I am not going to leave it in my life.
That's a great news, and I think that needs a big applause, and that's the lot of strength that you're giving to everyone. I'm sure Anuradha ma'am, Veena ma'am, Preeti Gumnani ma'am, and the others who are there would be listening to you, and they will leverage you to something where we can have all the 52,000 Inner Wheel members becoming tobacco marshals. That's a big applause. I think she needs it, and that's not only for us, but it's a motivating word for every one of us who are here. So thank you, Sonal ma'am, and I think it's time to. It's time that we. Oh wow, who is Rupali? You know, when she sent this message, it was really so heartening. Ma'am, पाँव जमी पर नहीं टिक रहे मेरे, and that is what she said. And एक ही था, and she was the tobacco marshal. So over to Rupali ma'am. Let's hear from you. आपके पाँव अब कहाँ पर हैं और कहाँ पर जमीन, और आप कहाँ पर, और आप क्या करना चाह रही हैं आगे चल करके, जब आपके पाँव जमीन पे नहीं होंगे तो क्या करेंगे आप? So as a tobacco marshal, Rupali, what are you looking forward for? आपको प्लीज अनम्यूट करना है, प्लीज अनम्यूट योरसेल्फ, Please unmute yourself, please.
Respected our pink chairman, Sonal Bhatia ji, respected Dr. Pawan, respected guests, and ICanCaRe team, and my dear friends, सभी को मेरा inner wheel नमन। आज मैं अपने दिल की बात शेयर करना चाहती हूँ कि टोबैको मार्शल बनकर मेरे पांव जमीन पर नहीं टिक रहे। मैं अपने आप को बहुत पावरफुल महसूस कर रही हूँ। ये तो हम सभी लोग जानते हैं कि तंबाकू का सेवन स्वास्थ्य के लिए किसी भी रूप में, किसी भी उम्र में नुकसानदायक है और इसके सेवन के भयानक परिणाम होते हैं। टोबैको मार्शल बनने से पहले हम अपने आसपास ये नहीं समझ पाते थे कि कौन तंबाकू ले रहा है, या पहले हमें लोगों को ठीक से कन्विंस नहीं करना आता था कि वो तंबाकू कैसे छोड़े। किंतु आज टोबैको मार्शल बनने के बाद हम पता लगा सकते हैं कि हमारे बच्चे तो कहीं इसका शिकार नहीं हो रहे हैं। अब हम तंबाकू छुड़वाने का प्रॉपर तरीका सीख गए हैं। अब हम समाज में फैली इस बुराई को दूर करने के लिए पूरी तरह से तैयार हैं। हम अपने बच्चों, युवा वर्ग, अमीर गरीब, सभी बुजुर्ग, सभी को इससे होने वाली बीमारियों व अन्य नुकसान के बारे में बता सकते हैं। उन्हें बता सकते हैं कि ये एक बीमारी है जिसको डॉक्टर्स की सहायता से दूर किया जा सकता है। अब मैं पूरे आत्मविश्वास से भरी हुई हूँ। अब मुझे लगता है कि हम अपने समाज व देश के लिए कुछ कर रहे हैं और एक तंबाकू मुक्त समाज की स्थापना करने में अपना कुछ योगदान दे पा रहे हैं। इसी के तहत नो टोबैको डे पर हमने भी एक कोचिंग सेंटर पे जो है बच्चों को वर्कशॉप की थी और वहां पे उन्हीं बच्चों को सबको समझाया था कि कैसे करना चाहिए, कैसे इससे मुक्त हो या इसके नुकसान क्या हैं, या वो बच्चे बहुत अच्छी तरह से हमारे से कन्विंस हुए। तो मैं आगे भी इन कार्यक्रमों में भाग लेती रहूंगी और करती रहूंगी। मैं आभारी हूँ अपनी डिस्ट्रिक्ट चेयरमैन सोनल जी की, जिन्होंने ICanCaRe से जुड़कर इस मुहिम को इतने बड़े स्केल पर चलाया और हम सभी को टोबैको मार्शल बनने के लिए मोटिवेट किया। मैं आभारी हूँ पूरी ICanCaRe टीम की, जिन्होंने इतनी मेहनत और लगन से हमें ट्रेनिंग दी है। अब जो लोग मार्शल नहीं बने हैं, मैं उनसे यही रिक्वेस्ट करती हूँ कि वो लोग मार्शल बनिए, क्योंकि ताकत वतन की हमसे है, हिम्मत वतन की हमसे है, इज्जत वतन की हमसे है, इंसान के हम रखवाले। धन्यवाद। मैं यही बस सोचती हूँ, करती हूँ।
थैंक यू सो मच मैम। आपकी ये बात सुनकर एक कवि की बात और याद आ गई मुझे। कहा था, बहुत ही सिंपल सादे अक्षर में ये कहा था कि जब सोच बदलती है तब विचार बदलते हैं, सोच और विचार बदलते हैं तब नजरिया बदलता है, और जब सोच, विचार और नजरिया बदलता है तो नजारे अपने आप ही बदले से नजर आते हैं। एंड आई थिंक आप सभी ने ये पूरा बहुत ही अच्छी तरीके से बता दिया। एक छोटी सी परिवर्तन सोच में, एक छोटी सी ख्वाहिश, एक छोटी सी परिवर्तन एक विचार में कितने प्रकार के बदलाव ला सकते हैं सभी नजरियों में, और किस प्रकार की रिपल क्रिएट कर सकते हैं सोसाइटी में। आज को हमने देख लिया और हमारे सभी एक्सपर्ट से आज हमने जाना कि यस, टोबैको मार्शल्स आर द नीड ऑफ द आवर। चाहे वो सोसाइटी में हो, चाहे वो वर्क प्लेस में हो, चाहे बस डिपो में हो, हॉस्पिटल में हो, या फिर एक ग्राम पंचायत में हो, एक विमेन, एक लेडी, एम्पावर्ड लेडी can end the suffering of masses and bring that real revolution. So hats off and a big round of applause to the entire team for taking this effort and the great initiative ahead, for making this entire program successful and for making the project better. We move ahead towards the most फॉर द इवनिंग जहाँ पे हम विनर्स हमारे डिक्लेयर करने वाले फॉर द कॉम्पिटिशंस। हमने 2 कॉम्पिटिशन ऑर्गेनाइज किए थे। द फर्स्ट पोस्टर मेकिंग कॉम्पिटिशन फॉर डिजिटल पोस्टर और हैंडमेड पोस्टर दोनों अलाउड थे। और इसके लिए मैं आमंत्रित करना चाहूंगी हमारे प्यारी सोनल मैम को ताकि वे विनर्स को डिक्लेयर करें।
Thank you, Shruti. Winner of poster, 3rd prize, Madhu Bhargava, IWC Meerut Prabhat. I could see Usha ji.
Yes.
Congratulations.
Thank you, ji. Thank you.
Is the winner. Great. Second prize, Manita Agrawal, IWC Chandosi City Star. Chandosi City Star.
Congratulations. Thank you, ma'am. Thank you, ma'am.
And first prize goes to Samriddhi.
Samriddhi Bhatia.
Samriddhi Bhatia.
Many congratulations. Well done. Congratulations, Samriddhi Bhatia. ये समृद्धि भाटिया
थर्ड भी देख लो आप अपना।
मैं भी देखती हूँ।
ये आपका मधु जी।
Thank you so much, ma'am. And now we move ahead towards winners declaration for the MIME Act competition. So I'm very happy to let ma'am declare the winners again.
Third prize, IWC Dhampur Royals, District 310, President Sonika Gupta. And prize goes to my sweet Amma ji. Are you there? No, she is not there, I think. IWC. And now second prize goes to
Hello.
Yes. Dhampur Royals, are you there?
Thank you so much.
Yes, ma'am. Thank you so much.
Amma ji, can we see you?
My name is Shalini Gupta.
Yes, I know. Yes, you are Shalini Gupta, but you act so nicely like Amma ji, na? That is why I am calling you Amma ji.
Okay.
Second prize, IWC Nazibabad, President Rama Shukla. Secretary Nazibabad, are you there? Rama ji? And first prize, cross your fingers. IWC. Any guesses?
Hello.
Yes.
Anubha Agrawal, IWC, Hasanpur Rasta.
Chandpur Arohi. IWC Chandpur Arohi.
Wow, well done, Arohi.
Club President Neeru Gupta. And participant name is Dr. Vinita Singh.
Many congratulations.
I think I made a mistake in putting the names. I'm sorry, ma'am. I've made a mistake in putting the names here. I'll change it as per the announcement.
Thank you.
Okay, I'll make the changes and we'll put it on the committee group and वो दोबारा भेज दिया जाएगा तो वो मैं changes करके दोबारा share कर दूँगा. I'm so sorry for the mistake from my end.
Hello, Shalini. Congratulations to you.
Okay, so let's move ahead. Thank you so much and congratulations to all the winners. I'll post this on every community page of ICanCaRE. आप सभी को winners list दोबारा मिल जाएंगे. I'll make this correction. I'm so sorry for the error from my end. This is a small felicitation of the ICanCaRE Tobacco Marshals. A small felicitation and recognition of all the Inner Wheel Tobacco Marshals who have been tirelessly working for the past 2 months together with Sonal ma'am to bring this difference. So please pat yourself on the back. That you're part and parcel of this program. You're part of this network. And you're part of the ever-growing revolution of the Tobacco Marshals and taking the lead ahead for tobacco control. So congratulations, a very hearty congratulations to all the clubs and to all the members who have really taken this step to make a difference, to create an impact, and to bring that change in the society.
They are my pink stars. They are my Inner Wheel Tobacco Marshals. They are strong women who are ready to create stronger world. We have done this in a very small span of time. Only 1.5 months we have done this. We have created so many Inner Wheel Marshals, and still more are ready to be there with us. I think I need no words to express my thoughts, as you can see my eminent delegates on the screen. Our battle has started against this social evil. We all women at Inner Wheel are so strongly committed to serve the humanity. We all are ready. We all are proud to be the part of this organization. We all are glowing the garden of Inner Wheel with our uniqueness after becoming marshals. It is my dream project, and you can see all my team there with me.
सोनल जी मेरी अनम्यूट करिए वीडियो.
आप अनम्यूट ही है मैम, अभी बोल पा रहे हैं, हम आपको सुन पा रहे हैं. जी
म्यूट कर वीडियो म्यूट.
They all are ready to raise the voice together to save the youth, and they are all tobacco marshals, Inner Wheel tobacco marshals, which we have created. They all are my strength. They are all going to fight against this tobacco, this dragon tobacco. With me, my team is ready.
Thank you.
They are Shiros. I can say they are my pink stars, real heroes.
Thank you. Thank you, ma'am.
Something is wrong. I'll play again. I'll play the video again.
My Shiros, real heroes of the society. They all are tobacco marshals, Inner Wheel tobacco marshals, those who are going to fight against this tobacco. They are never going to stop here. After gaining knowledge, they are going to spread, they are going to share their knowledge in the society. These are all marshals which we have created, Inner Wheel tobacco marshals.
Big round of applause, everyone. Please pat yourself. Ma'am, आपके साथ है नहीं, virtually है, तो इसलिए उनके behalf पे please अपने आप को pat करिए. Pat your back. Feel proud that you have done a fantastic job. You're a proud leaders of tobacco control. The next generation leaders take this ahead. With this, thank you so much, everyone. I think we've come to the end of the program, and before we move towards the final concluding slides, I would take this opportunity to thank everyone who has been part of this event, who have tirelessly worked across the month to make this event really successful. I would first like to thank all our special guests, Mrs. Preeti Sudan, IAS, Dr. Swasticharan from Government of India, Dr. Biswajit, Saha, Director of CBSE, all our faculty members, Dr. Shalini Singh, Director of NICPR, Dr. Smitha Garg, the Head of Advisory Committee and Community Medicine, NIHFW, Professor Dr. Paramita Sengupta, HOD from Community Medicine, AIMS Kalyani, Dr. Mrs. Pravesh Singh, faculty at Kite Group of Institutions, Mrs. Anuradha Chandak, Honorary Association Secretary, Mrs. Veena Swami, National Editor from Association of Inner Wheel Club, our conveners, Dr. Pavan Gupta, Dr. Mrs. Sonal Bhatia, Dr. Reena R. Kumar, a special guest, Mrs. Preeti Gugnani, Inner Wheel Association Vice President and Deputy National Representative, all our ICanCaRe team, Dr. Gitika Sharma, Dr. Rishabh, and of course, all the members of the Inner Wheel Club who have been tirelessly working to make this event really successful. All our audience, a very big thank you to you on the social media platform as well, for staying connected with us for the entire 2.5 hours, and I'm sure you have loved and enjoyed this program thoroughly. With this, I would like to share that tobacco is a social outrage, and the changes can only come in when we have large number of people. If we have 50,000 strong army of marshals joining us and raising voice against tobacco, and in turn 5 more people from every of this member joining the network, just imagine we'll have 2.5 lakh community members just in 1 year to really make a difference and to raise opinions and voices, reach out to the government to say that yes, it's time to ban tobacco, it's time to take strict actions. Let's create more power, let's give more power to women, and then force empower. I have specifically put WHO empower because we can do everything from monitoring to policy building to offering help and support and ensuring that each and every individual is able to quit the habit very successfully. Under the Save the Youth campaign, I invite once again on behalf of ICanCaRe and Inner Wheel District 310 to all our ladies, to all our audience, including men on the social media platform and on Zoom, please join us as change leaders and let's create this revolution. Let's make this impact very successful. Let's bring a healthier world free from the slavery of tobacco. Let's create a smoke-free world for our upcoming generation. Let's have a fresh air to breathe in and show the world that yes, India is the leader for all sorts of community activity. And together, with this public-private partnership, we can take ahead and create revolutions not only for tobacco control, but endless of non-communicable diseases, including cancer, tuberculosis, chronic respiratory diseases, and cardiovascular diseases. Let's pledge Tobacco Marshal. I invite all of you to join the Facebook community page to stay connected throughout the year and stay in touch for all the activities and stay tuned for more upcoming activities. I hope you had a lovely weekend. I'll stop sharing here, and now the forum is open for a quick round of comments and feedback from the audience. Any questions, any suggestions, feedback, it's all open now. Anybody would like to say something?
I'll say खुद से वादा.
Sorry, ma'am.
खुद से वादा, मेहनत ज़्यादा और मजबूत इरादा.
Bilkul, what a lovely statement.
Thank you.
Girja ma'am, nice to see you after such a long time.
Thank you, Shruti. Nice to see you. I'm so happy that Sonal has taken this initiative from 310 and District 315 follow you, Sonal. And I have been associated with ICanCaRe for the past many years, and I appreciate the, what do you call, untiring involvement, dedication, focus of Dr. Pawan Gupta and Shruti and their team. They don't sleep a single day, 24/7. They work for this tobacco cessation. And Shruti and Pawan, we are all with you and we follow Sonal.
Absolutely, ma'am. We're going to replicate this in the South. We have to make this model successful in the South as well.
Sure.
Thank you so much. And I think it's just wonderful if we can have a wonderful pictures of the wonderful ladies that who are here, that please switch on your camera. And Shruti is ready with her camera. I think she will just take a click. So
yes, we'll request everyone to please put on the videos and put on the best smiles, best view and the best smiles.
Kumkum Mathur, please switch on your camera, switch on your video.
We'll request all the members.
Veena ma'am and Anuradha ma'am, are you there?
Can't see them. I think have dropped off.
They left.
Dropped off, I think, ma'am. Can't see them.
Dr. Paramita, if you are there, please switch on your camera so that we can. And Dr. Sunila is also there. If you can switch on your camera. Seema Agarwal, Madhu Bhargav. Can you please come in?
All right, ready for the click? Is everyone ready for the click with the best smiles and the best position? Ready? On the count of 3, 3, 2, 1, go. Okay, the first screen is taken. Let me take for the second screen as well. Second screen पे काफी लोग नहीं है वीडियो ऑन करके. Will request अगर please आप वीडियो ऑन कर लें. Again on the count of 3. Ready everyone? 3, 2, 1.
आप इसमें कर लो मेरे में आ जाओ.
Thank you so much everyone.
मेरे में तो मेरी फोटो लगी हुई है मेरे.
रजनी जी आपका फोटो रह गया.
फर्स्ट शॉट में आ गया सर. उनको एडिट कर दिया जाएगा. फर्स्ट शॉट में आ गया.
So it has been a wonderful day today. I think we have so many tobacco marshals who have showcased their ability and the way they have done.
मेरी फोटो आ जाएगी.
अब और नहीं आएगी, चली गई. अब आप अपने आप खींचिए अपनी फोटो. सेल्फी लीजिए.
क्या कह रहे हैं?
सेल्फी लीजिए, सेल्फी लीजिए अब अपनी. चलिए, तो अगर किसी को कुछ कहना है, we are here at 5:30. Actually, we started 16 minutes late, so we are not too much over time. तो अगर किसी को कुछ कहना है और कोई संदेश पहुंचाना है, प्लीज फील फ्री। नीरू जी, प्रीति जी, अनुभा, रजनी जी कुछ कहना चाहती हैं, रुचि जी, उषा गर्ग अपने गाड़ी में बैठ के चल पड़ी हैं, तो रेखा जी, उषा राज ने तो कह दिया। ओके, I think thank you so much. We have a great group of tobacco marshals और हम लोग जरूर चाहेंगे कि आगे और कितने लोग भी जोड़ सकते हैं। जैसे रूपाली ने कहा था कि we need everyone in the inner wheel who is there should be a tobacco marshal. Wonderful message, Rupali Garg, and I think it should percolate down to all other members across your district. And मैं यही उम्मीद करता हूँ कि जितना प्यार आप सोनल जी को एज ए डीसी कर रहे हैं, इवन आफ्टर डीसी और एज ए डीसी, यू विल कंटिन्यू एज ए टोबैको मार्शल एंड गिव हर ऑल द लव एंड अफेक्शन दैट शी डिजर्व्स फॉर द वर्क दैट शी इज डूइंग फॉर द सोसाइटी। सो ए बिग अप्लॉज फॉर सोनल जी, सब लोग की तरफ से जोरदार अप्लॉज।
थैंक यू सर। थैंक यू सर। थैंक यू मैम।
और आप सब जितने भी टोबैको मार्शल्स हैं, अपने पीठ को थपथपा करके अपने आप को शाबाशी दे कि आप लोग बहुत अच्छा काम कर रहे हैं। आज आपने सुना कितना लोगों ने आपको सारे, वी हैड ऑल द सीनियर डिग्निटरीज अक्रॉस इंडिया।
बाय एवरीवन।
बाय।
थैंक यू।
मैं कुछ कहना चाहूंगी लास्ट में अपने मार्शल्स के लिए।
बाय मैम।
यस मैम।
काम करो ऐसा, तुम लोग काम करो ऐसा कि पहचान बन जाए। जिंदगी तो हर कोई जी लेता है, पर जियो ऐसे कि पहचान बन जाए।
थैंक यू सो मच।
थैंक यू मैम।
थैंक यू मैम। थैंक यू सोनल मैम।
ये सब आपकी मोटिवेशन से हुआ है मैम।
बाय
आपने
एवरीवन।
इतना मोटिवेट किया हम लोगों को। नाउ वी आर फीलिंग वेरी टॉप ऑफ द वर्ल्ड।
इसमें तो इसे कैसे पुरस्कृत करोगे, इसमें अंदर कैसे करोगे बोल रहे।
चलिए बहुत बहुत शुक्रिया आप सभी का। हैव अ ग्रेट वीकेंड अहेड। प्लीज अपने आप के जज्बात को, थैंक यू सो मच मैम, अपने जज्बात को डाए मत होने दीजिएगा, उससे जागरूक रखिएगा। एटलीस्ट एवरी 3 months में कुछ कुछ करके शेयर करते रहिएगा एक्टिविटीज। कोई और आइडियाज चाहिए तो आई एम ऑलवेज देयर, पवन सर इज ऑलवेज देयर, सोनल मैम इज ऑलवेज देयर फॉर आइडिया शेयरिंग फॉर कैंपेन्स। कीप डूइंग दैट, keep that persistence, keep that passion and rigor and flame burning within you. So have a great weekend everyone. Thank you so much.
Special thanks to Sonal ma'am.
Love you.
Great program, great achievement, and special thanks to Dr. Paul.
Thank you, Sonal ma'am and Dr.'s team. Thank you.
Thank you.
Thank you, Anubhav.
Thank you, Sonal ma'am. Thank you so much.
Thank you.
Thank you, Dr. Saab.
Thank you so much. Thank you.
Great. Chaliye, I'll close the meeting for now. Have a great week. Have a great time. Chai by PJ. Peace.
हाँ जी, thank you.
मेरे लिए भेजिए।
Come and join. Come and join.
Ma'am, North Anna is जरूर आऊंगी आपके पास। North Anna is definitely.
चलिए, okay.
Bye. Take care. Have a great week.
अच्छा लगता है जब भी आप लोगों के साथ होते हैं।
आपके पेशेंट ठीक हो गए या है?
ऊपर से दिखाई देगा ना उसका।
बहुत अच्छा लगता है जब भी आप लोगों के साथ जूम पर होते हैं, तो मतलब एक एनर्जी बॉडी में आ जाती है, बिल्कुल मेंटली रिफ्रेश हो जाते हैं सुनकर सब।
Thank you so much. Thank you. Thank you.
चलिए, sir, with your permission, ma'am, with your permission, I close the meeting.
Yes, Shruti.
Okay, thank you. Bye bye.